My name is Shiv Govindji. I'm a third-year medical student at UT Rio Grande Valley School of Medicine. And today's presentation is about looking at the association of social determinants of health on coronary artery disease and myocardial infarctions in Texas from 2017 to 2021. So a little bit about the background of the presentation. So social determinants of health, abbreviated SDOH in this presentation, are non-medical factors that influence individuals' health and well-being. So these factors can include socioeconomic status, ability to find work and be employed, education, access to healthcare, housing, and the environment. I think there's been a recent focus on social determinants of health, especially in medical schools, and there's been a lot of studies looking at these factors and its effect on cardiovascular health. However, there's been a deficit of literature regarding these factors impacting specifically heart health of those in Texas. So the objective of the presentation is to look at the association of social determinants of health and other factors and coronary artery disease and heart attacks in a randomly sampled adult population in Texas. So the methods of the study, I use the behavioral risk factor surveillance system, and this is the largest national telephone-based survey system in the United States. The system contains de-identified public data of randomly sampled individuals. From 2017 to 2021, a 4-year span, cross-sectional data was collected from 46,196 participants in Texas and analyzed using multivariate logistic regression models. P-values less than 0.05 were statistically significant. Additionally, the analysis was performed to determine the relationship between multiple variables and self-reported diagnoses of coronary artery disease or heart attacks. These variables include demographic information and factors related to social determinants of health. And so here is just a little picture of kind of what the social determinants of health are. So my results showed that between the 4-year span in Texas, cardiovascular disease was most often reported in groups that are unemployed, white, non-Hispanic men, groups older than 65 with less than a high school education, with income levels less than $25,000, which is seen in Table 1, which is the demographic characteristics of self-reported cardiovascular disease in Texas from the same years, 2017 to 2021. Additionally, multivariate logistic regression showed age groups older than 65 with odds ratio 2.64, which is statistically significant, BMIs greater than 25, so overweight, and those who attended college or technical school but did not graduate or did not graduate high school, compared to age groups 18 to 64, BMIs less than 25, or college or technical school graduates were associated with a higher odds of coronary artery disease or heart attacks. When compared to participants currently employed, those with the highest odds of coronary artery disease or myocardial infarctions were retired, which was an odds ratio of 2.3, and that was also statistically significant, or unable to work with an odds ratio of 4.67. Additionally, former smokers and current smokers, which was stratified between every day and some days, so with an odds ratio of 2.33 and odds ratio of 1.98 compared to never smokers, both had significantly increased odds of coronary artery disease or myocardial infarctions, which was seen in Table 2, which is looking at the association between variables and coronary artery disease or heart attacks in Texas. So if we look at Table 2 again, of note, those with last routine checkups from within the past year to compared to those who really had one in the past year compared to never, there didn't really seem to have like a substantial increase in the odds ratio there. And in addition, those who alcohol didn't really seem to have an significant increase in the odds of heart disease as well, of self-reported coronary artery disease or myocardial infarctions as well. But in conclusion, there are a limited number of studies examining social determinants of health and cardiovascular disease in Texas. The findings suggest concerted efforts in addressing these specific variables described in the study may curb the prevalence of coronary artery disease or myocardial infarctions in Texas. Thank you.
All right, thank you so much, Shiv. We do have one question before you go, and that is, how do we change behavior in these high-risk groups?
Yeah, sure. So I think it's really going to be a multidisciplinary effort to sort of target these specific risk factors that I found to have an increased odds of causing this heart disease. I think these efforts could really take the form of public health initiatives or even lobbying efforts. For example, in the study, we found that smoking, even if you're a former smoker or even current smoker, had an increased odds of causing heart disease of some form. And so having either anti-smoking or more aggressive anti-smoking campaigns, or lobbying to have increased prices of cigarette packs may curb the prevalence. In addition, we also found that those who weren't able to finish school had an increased odds. And so decreasing the burden of education and finishing higher education may also curb the prevalence of heart disease in Texas.